Good morning, everyone. My name is Ricky Telg. I'm the co-director for the Outreach Corps for the Southeastern Coastal Center for Agricultural Health and Safety. And it's my pleasure to welcome you to this November 7th webinar with the title, Using a One Health Approach for H5N1 Response in Agriculture Settings. Ben Anderson, an assistant professor with the Department of Environmental and Global Health in the College of Public Health and Health Professions, will be leading this discussion and this presentation in just a moment. I just wanted to to let you know that today's webinar is being recorded, and so it will be on our center's website, archived there. So you or your colleagues, please feel free to come back to our website to watch the webinar again, if you'd like to do so. Also, at the end of today's webinar, there'll be an evaluation, a link that will be put in the chat for you to go to let us know how you enjoyed the webinar today. Overall, the chat is disabled for this webinar, but if you have questions, please feel free to put that in the Q&A, and at the appropriate time later in this webinar, I will facilitate that discussion with the question and answer with Dr. Anderson. And so with that, I'm going to turn it over to him. I'm going to stop sharing my slide here uh, and move on from there. So Ben, go ahead.
Wonderful. Thanks, Ricky. And good morning to everyone who's joining us today. Just give me one moment to do the clicks. Okay, I'm all set. It's a pleasure to be with you and have an opportunity to do a couple of things. In this webinar, the first thing that we're going to do is we're going to talk about what H5N1 actually is. We called it emerging infectious disease. Then we're going to get into more of the specifics about H5N1 itself. I'm going to provide you with the most up-to-date epidemiological data that we have regarding its transmission in the United States, and then talk about what I call key inflection points, really important events that have taken place over the last year that we need to pay close attention to. And then something I think what a lot of you are really interested in is what do we do about it? So jumping right in, the first thing I want to do is talk a little bit about what emerging infectious diseases are, because H5N1 is in fact that. It is an emerging infectious disease. And when we look at these two graphics, these are graphics that have plotted from in 2004 and also then in 2020, emerging infectious diseases or re-emerging infectious diseases. And I use this slide in my classes very frequently. And what I always ask my students is, what do you notice between the two graphics? And so we always take a minute to look at it. They ponder the question. And of course, the brave souls will speak up and say, well, the graphic on the right has more dots on it. And that's absolutely right. What we have seen from 2004 to 2020 is a distinct increase in the number of emerging and re-emerging infectious diseases that we have been able to identify. Now, part of this increase has come from the advancement in technology. We are much better at detecting new diseases than we were even 20 years ago. However, some of this is also due to some other contributing factors. And in fact, when we look at historical records, particularly in the last 100 years, we have a clear, distinct rise in the number and frequency of emerging infections or re-emerging infectious diseases that have occurred. And so some in the emerging infectious disease research space conclude that we have entered what we call a pandemic era. Now, what are some of the reasons for that? One of the reasons we know is that most emerging infectious diseases are what we call zoonotic. And zoonotic is a term that refers to the fact that the disease or the infectious agent that causes the disease can be reservoired in animals. In fact, we know 60%, maybe even a little bit more, of all emerging infectious diseases have been identified with this zoonotic criteria. And this is really critical then to understand that our interactions and to humans. We also know that this happens in reverse, and this is called reverse zoonoses. So as humans, we also can transmit certain things to animals, whether that be our companion animals, our dogs, our cats, birds, poultry, pigs, livestock, which we'll talk about more in this webinar. We know that this exchange of infectious material can happen both ways, and it does happen both ways. Because of that knowledge, one of the things that we pay close attention to is environments where we know there to be a high density or high population of animals with human contact, because that's something that then we would see a higher prevalence of potential transmission. It turns out, of course, food production is an area where we monitor. And we've seen over the last 30 to 40 years a transition from higher frequency, smaller operations for livestock production to smaller number, higher density production operations. And while this has created great efficiencies in the way that protein is produced, it also creates some trade-offs and potential risks around infectious diseases. The ability for those infectious diseases to transmit in these settings may be greater. One of the other things that we also know is that our food supply, how we actually get our food and the way that food is distributed globally, is not a local market typically. We may have ingredients for certain things that we purchase or consume within our communities that have been imported or shipped from far distances away. And so this creates a food safety and security concern where you have food products potentially serving as a vector for transferring and transmitting pathogens across great distances. And I work a lot with students, and students like salads, but also students also like burritos. So this isn't just relegated to produce. This is also other things as well. We also have a very robust livestock trade that happens globally as well. So that movement of product is constantly occurring. But it even goes further with a more complicated food security system. And this graphic is overwhelming, and it's meant to be that way because that's how our food security network looks. It's a pretty overwhelming network of a variety of different import-export policies, other things that are contributing to the way that food is being moved throughout the globe. Another factor we know that is influencing our rise of emerging infectious diseases is also climate change. And we're starting to understand a lot more the impact of this on more recent emerging infectious disease events, including H5N1. So with all of this in mind, with emerging infectious diseases being a very complex, complicated issue with lots of factors that can influence them, we have a challenge. And the challenge that we recognize is that there's no one discipline that is trained to engage in these what we call wicked problems. In addition, there's no agency or organization that is equipped to handle all the different aspects of the factors that are contributing to these issues as well. And then something that is continuing to be an issue is we are faced with limited resources. So how do we approach these challenging problems when we know that we have these constraints? Well, one of the ways that we do that and that we've opted to move forward in this space is something called One Health. And One Health is an approach that focuses on this human, animal, and environmental interface. So where those things exist, recognizing that our shared environment and the animal and human contact and bonds that exist there are opportunities for us to understand how health impacts occur. And so one of the key aspects to One Health is really recognizing that we need to bring multiple disciplines together, multiple perspectives, multiple stakeholders together in order to be able to solve these complex issues because they are so multifaceted. And when we do that in a practical way, it seems to be common sense, but we use something called the 4 C's, which is communication, collaboration, coordination, and capacity building. And while on paper, these look really nice, and they're really nice to say, they're actually very difficult to implement when we're working on complex issues. And I'll talk a little bit about that as we move forward into the H5N1 section. And that's where we are now. So setting up this part is that H5N1 is an emerging infectious disease. and emerging infectious diseases have a lot of factors that can contribute to their rise and spread. But what is known as H5N1, or what people see it in the news as bird flu? Well, the first thing we have to understand is that H5N1 is known as an influenza A virus. And influenza A viruses are not uncommon or unknown to most people. They circulate very often among humans. So most people will know that we have a seasonal influenza spike every fall, winter. This is also why you hear about influenza vaccinations. But it turns out that influenza A viruses are not just viruses that circulate in humans or have human strains. There are also influenza A viruses that circulate in other species, other animals. And one of the things that's interesting about influenza A viruses is that they have a somewhat unique genetic structure. So the genetic code is what makes up the structure and function of the virus. It's what codes for all of the proteins that are going to actually make that virus form and function. And in the case of influenza A viruses, they have what we call a segmented genome. And that means they have, in the case of the flu A, they have 8 gene segments. And that's different than other viruses that have one complete genome. Why that's important and why it will be important to our discussion here is that influenza A viruses can mutate. So if you think about COVID, and COVID had changes in the type of what was called subvariants, Omicron, Delta, those were happening because of the ability of the virus to make small changes to its genetic code. And over time, when those changes add up and accumulate, it can change the way the virus functions and the way that it's structured. The same thing can happen for influenza A viruses. They also can mutate and accumulate those small mutations over time. But one of the other things they can do is they can mix with other strains of influenza viruses, and they can swap out their genes because they have these segmented genes. When that happens, there's a potential of something called recombination. So the genes recombine and they make a brand new virus that's something that may be something from a human strain, something from a bird strain, and that is where we get pandemic potential. So the possibility of an influenza virus causing a major outbreak is often due to that ability for it to recombine. So that's a really important principle when we're trying to understand the concern and risk and impact of H5N1 in the United States. Because we know that influenza A viruses have a mechanism to be able to transmit across species. So they're not contained just within one species. There are many pathogens, many viruses, bacteria that may just circulate within one particular species, and we call that a species barrier. It can't jump out of that species very easily. But influenza A viruses are very good at jumping out of that barrier because of the way that they replicate and the way that they bind and the way that they impact biological organisms. So when there's close contact between species that can carry the virus, there's an increased risk of that zoonotic or animal to human or human to animal transmission to occur. And the public health impact of that then becomes cross-species transmission that can potentially lead to new pandemics. This is a graphical representation of what I described and the ability of flu viruses to change over time, which is what is known as antigenic drift. And this is something that is why we have seasonal influenza vaccinations. The strains that were circulating a year ago are not going to be exactly identical to the strains circulating now. So the human immune system may not be able to have the right immune response to the new circulating viruses as it did previously. So influenza A vaccinations seasonally are updated in order to better match those viruses. But for the recombination, what I was talking about there, that's what we call antigenic shift. And that's a sudden, very major change in the genetic sequence of the virus that we may not be prepared for until it starts to impact humans and become identified in the population. The last time that this happened was in 2009. So we had an influenza A pandemic in 2009, where the origins of that virus, the new virus that was causing those illnesses, came from a pig. And it was a recombination of a pig virus and an avian virus and a human virus that thing all came together and created a brand new virus that spilled out into humans. So this is something that, again, we pay very close attention to because of the nature of influenza A viruses. Now, transitioning specifically to H5N1, which is known now kind of colloquially as bird flu, this virus was first detected in domestic waterfowl, so domestic bird species in southern China in 1996, and it caused the first human outbreaks in 1997 in Hong Kong. This virus was identified and called high pathogenic or highly pathogenic avian influenza virus, primarily because when it gets into certain species, it can cause very severe illness and even death in those species. We do know from the data that has been collected over the last 20 plus years, there has been a total of about 1,000 human identified infections of H5N1 where people have had very close contact with birds, either poultry or waterfowl, and have become infected with this strain of virus. Now, thankfully, we have not seen H5N1 in the historical records transmit from person to person. And that would be the very final step for a virus to potentially become pandemic, is to gain the ability to do person-to-person transmission. However, with our data, we do know that the virus is very pathogenic or causes very severe health outcomes in humans when they are infected. So in fact, the data that we have collected, of the 1,000 or so cases that have been identified, half of them have died. So this is a very high mortality event data set. Now, that mortality rate probably is a little overestimated because maybe there's a number of infections that have not been identified. We often don't see infections that are causing mild illness or no symptoms at all. So I wouldn't say that 50% is the absolute mortality rate, but it's still a much higher rate than what we see for other types of influenza viruses. So it creates a public health concern that we need to pay very close attention to when we see this virus circulating in animals where people or other types of animals might come in contact with it. So, how does this virus move throughout the world? Well, because migratory birds, waterfowl are migratory, they can move the virus and reservoir it from one part of the world to the other through the known migratory bird pathways, and that's exactly what happens. So we have a large range and a large diversity of how migratory birds move around. And for a lot of migratory waterfowl, when they are infected with H5N1, they actually can handle the infection quite well. There's not as much mortality among those birds. So they may still be infected, but then move that virus in different parts of the world. And this is exactly how H5N1 has become so broadly distributed throughout the world over the last 20 years. And this has been a pretty consistent, there has been a pretty consistent amount of detection of H5N1 through monitoring systems that are set up for influenza throughout the globe. Up until more recently, there has been some changes. And what has happened since 2022, the detections of H5N1 in both migratory birds and other animals has drastically shifted. So we have now started to see a different kind of H5N1. So remember I mentioned how H5N1 can change. It can recombine, it can make new versions, do new genetic sequence codes. And that's exactly what has happened per our research. We know that as early as 2021 and 2022, we have started to see some different recombined versions of H5N1 in the migratory birds. And when we look at those viruses and we test those in the laboratory, what we can see is that those newer strains are more likely to transmit to mammals. So birds are avian species, and then we have mammals. We are mammals as humans. So when we see an increase in mammal infection in our laboratory testing, that raises some alarm bells that potentially this strain of virus could be a greater risk of infecting people. Well, with this detection and understanding that globally we have a new diverse amount of recombined H5N1 viruses that are circulating, at the same time in 2022, we in the United States started to see a much greater amount of this virus circulating within our population of birds and other animals. And prior to 2022, in the United States, we have been largely spared from outbreaks of H5N1. We did have some small outbreaks that had previously happened that were well contained, and there was an outbreak that happened in 2014, but with a different strain of H5 known as H5N2. But in large part, even though H5N1 has been broadly circulated, we have not had great impact in the United States up until 2022. 2022, we started to see a much greater detection of H5N1 among wild birds. So these migratory birds that come through the United States, they carry the virus, and we have identified that virus at much greater levels and much greater frequency than prior to 2022. In addition, this virus affects avian species. It really likes to jump into poultry. And in the United States, we have areas that have a high level of poultry production, and we have had drastic outbreaks of H5N1 in our poultry operations and our poultry facilities beyond what we've ever experienced before in the US. You can see some statistics here, 1,197 outbreaks reported as of this morning, affecting over 105 million birds. So the strategy of control when H5N1 shows up in a poultry operation, the USDA, in combination with the state agency that's responsible for agricultural regulation, will go and respond, and they will call the flocks. And this is a strategy to prevent further spread and for additional transmission to occur, particularly in proximity to other production facilities that may be within a certain amount of distance from that infected flock. And this is it has been particularly effective, but has started to become more challenging and not shown as much as impact in terms of control, not necessarily because of the culling itself. That is effective in ridding the operations from the virus, but because the birds are carrying the virus in such high amounts, they are vectoring, they are transmitting that virus into other poultry operations. So it's becoming very difficult to prevent transmission from H5N1 into our poultry facilities. In addition to that, since 2022, never before have we seen such a high frequency of detection of this virus in mammals. So remember when I mentioned that we have tested the newer strains of bird flu in mammals in the laboratory? Well, since then, we have seen a spillover of H5N1 in a very large number of different mammal species. In the US, we know that at least 23 mammal species have been identified since 2022 with H5N1. Globally, that number is even higher. It's over 55 mammal species. We are seeing the virus show up in mammal species beyond anything we've ever seen before. Now, maybe some of that is part of increased surveillance. We haven't detected, we haven't done testing of every animals like we have been doing recently, but for a lot of the detections, they are part of longer term systems of surveillance. And so there is the argument that we can make that we are seeing a very high increased frequency of mammal detections for H5N1. So coming back to looking at, again, the relationship between H5N1 and migratory birds, you can see here these, in the United States, we have 4 major migratory bird pathways that are vertically transiting down through the United States. And we see along these pathways a pretty close, what we call a geospatial, so time and place. associated with these migratory bird pathways. So then we know that the migratory birds are driving a lot of the transmission that's happening in detection in these poultry facilities. Okay, so take a quick stop there. If that was not enough, more recently this year in March, there was a press release from the USDA that announced for the first time ever in the history of this virus that we have known of, H5N1 was detected in a US dairy farm in Texas. And the story behind that is that a veterinarian was responding to a dairy farm that was dealing with mastitis. And for those on the call who don't know what mastitis is in dairy cows, it's an infection or inflammation of the mammaries that often impacts and reduces the quality or the ability for the cow to be milked. And there's a lot of things that can cause mastitis, a number of infectious agents that are typically looked at. And when the veterinarian responded to this and they tested and looked at all the possibilities that they know of, none of them were showing up positive. So they were not able to identify what was causing this mastitis. So this veterinarian, who is very smart and very clever, sent a sample to a colleague in Iowa, and they, through the description of what was going on, suggested maybe testing it for H5N1. And sure enough, that sample showed up positive. So an example of someone who on the ground who was very aware of their the setting, the situation, and was problem solving the circumstances, was able to identify that this was actually H5N1. In addition to the cattle being infected and it causing infection throughout the whole herd, there was also on site a number of cats that were identified that were dead. And after autopsy, or sorry, necropsy, it was shown that those cats actually were infected with H5N1, and the virus is what caused their death, what was known as neurotropic infection. So it affected their neurological system, and the virus was up in their brain. So very, very concerning when we see those kinds of infections taking place. This set off a series of events to start looking more at this virus and the potential transmission and circulation in other dairy farm settings. Beyond that, we also started to see not just the cattle being infected and having symptoms, but also the cats. In addition to that, then starting to see what we're most concerned about when we think about pandemic potential is human impact. And sure enough, not long after the first detection of the virus in Texas, we started to see some human infections pop up. And this was one of the first ones that was identified and characterized. And thankfully, the first couple of cases actually presented with very mild clinical symptoms, mostly conjunctivitis. So that is still a symptom that is distinguishable for a lot of the H5N1 infections that have been identified to date among people. And we haven't seen the type of severe infection as we have seen with other H5N1 infections that I talked about previously, where they had the very high mortality rate. But nonetheless, because it is an H5N1 strain, anytime we start to see it show up in people, we become very concerned because, as I said, influenza A viruses can always change. They can adapt, they can mutate or recombine. So any detection is a concern. Something that we also have looked at, which not to be overly technical, but I do include this slide because, again, I want people to understand the context of why we are concerned. When we look at the dairy cows, why in particular were they susceptible to infection? It turns out that the receptor or the protein, which is how viruses get into cells to replicate, they attach to a protein on the outside of a cell, they get into the cell, and then they're able to use that cell to make more copies of themselves. When that receptor exists in multiple organisms, that's when you can have more transmission across different species. And that's exactly what was found in the dairy cattle. In the mammary glands, there are a high number of those protein receptors that virus can bind to, and is what caused essentially the outbreak to occur in the dairy farms. We, through epidemiological study, have also been able to see that even though this first case was identified in a farm in February, it is very likely that there were cases or transmission of the virus occurring in dairy farms even sooner than that. It's just that we didn't detect it until some of the cattle became clinically sick, and then we understood that there was a virus causing an outbreak. Because of all this happening at that time, our regulatory bodies, the USDA, started to implement some control measures. So one of the first things they implemented was a limited movement rule, where they are regulating the interstate transfer of dairy cattle, so not beef cattle, but just dairy cows from state to state. And they stated in this rule that if you wanted to transport a dairy cow from one state to another, you have to show that you have a negative influenza test, and they have some criteria around that. So was that effective in reducing the transmission? Well, it's hard to say, but we still saw quite a bit of continued transmission and outbreaks across a variety of states. And to date, we now know that this particular strain of influenza H5N1, what we kind of call the dairy strain, has been identified in 15 states, most recently in California and in Utah. And they have represented a total of 446 total confirmed cases or total herds that have been infected. So it's a pretty high number. Interestingly, though, a large portion of those detections have increased more so in the last 30 days and have been identified in California. So one of the things to take away from this webinar is that the data that we see and that we look at is only as good as the amount of looking that someone does. So if a person or an entity or an agency doesn't have as much looking going on, you're not going to see as many cases. When you have a high amount of looking, of surveillance, you're going to see a much higher number, likely as an artifact of that surveillance. So it's hard to say here if certain states have higher numbers than others. We know that in Michigan, Colorado, and California, they have had the highest number of herds with positive cases. But we also know those three states have done a much more intensive amount of surveillance. And so that's likely why we're seeing an uptick there. And states that don't have any H5N1, does that mean that it's not circulating there? It hasn't shown up there? It's possible, but also possible it just hasn't been identified yet because there hasn't been the right surveillance being done. So with all of that circulating and knowing that it has been able to cause some infections in humans, and we know that there are humans, agricultural workers, that are working in these settings, there has been a lot of exposure. And the CDC and the state agencies that have been responding to these have been working to monitor those exposed individuals and test them and see if they actually become infected. And through those activities, to date, we have identified 46 human infections. Thankfully, there have been no reported deaths from the virus, so that is very good news. Most of the infections have been relatively mild, for the exception of a couple. But again, we're not seeing that high mortality rate or the high morbidity that has been seen in human infections previously. But we still need to be concerned because, again, the virus can change and it can have different characteristics the longer it circulates in an animal. So with all that being said, human infections, wild birds, poultry, dairy herds, cats, other mammals, the takeaway here is this virus is really everywhere. It hasn't really made it into a sustained transmission right now in the human population, and we're very lucky and very fortunate that that's not the case. This is also why you'll see recommendations through USDA and CDC that says the risk to the public is low. But we still have a great concern about potential future risk the longer this virus circulates in the high number of species that we see it circulating right now. So next, transitioning to our key epidemiological inflection points. What I mean by these is these are just key events that we've really honed in on to be paying attention to as, wait, that's not necessarily consistent with what we've seen with other epidemiological data. And when something is not consistent, it stands out, that can sometimes mean that the virus may have changed. And so that's why we have to look at that very carefully. One of those has been a cluster of H5 detections associated with a poultry exposure in Colorado. So there were two poultry facilities that had H5N1 detected in the flocks. And when the responding workers that are part of the response team for the state agency in Colorado, when they were exposed, they actually became infected. And the really interesting and concerning part of this case is that the strain that we can identify with laboratory testing, something we call sequencing, which allows us to know the exact genetic sequence of that virus, matched exactly to the virus that was circulating in a nearby dairy operation. So that begged the question then is, how is a dairy strain being transmitted into a poultry farm and then ultimately ending up in these exposed individuals? So that's a question. Next, we've had a case in Colorado where 6 cats, as I mentioned, the cats on the dairy farm that were first detected in dairy cows, those cats were infected and died from the virus. So we know cats are a susceptible reservoir. They can be a host to the virus. In Colorado, through some of the surveillance that was done through companion animal clinics, 6 feline cases of flu H5N1 was identified. One was associated with a known infected dairy commercial facility, so that makes sense that they would be exposed to that in that facility. However, what doesn't make sense to the epidemiologist is 2 of the 6 cats were indoor cats and had no direct exposure to animals. And 3 of the 6 cats were indoor-outdoor cats, but also had no exposure to livestock, but they did hunt mice and or small birds. So the question here is, can cats be a consistent reservoir and transmit H5N1, and how are they picking up the virus? Is it through migratory birds? May they be exposed to livestock? What is the risk associated with that? Next, we had, I think, what was a really big concern that happened about a month and a half, 2 months ago in Missouri. For the first time, we had a human case of influenza H5N1 identified in a hospital. And when individuals go to clinics and hospitals, there is routine testing done for influenza A viruses, because again, there are human influenza A viruses that circulate. When they did this testing of this individual, they were not able to identify it to be a human seasonal influenza virus. So there's some protocols that then are followed, additional testing that is required, and that additional testing includes looking at H5N1 as a potential suspect of that virus. And sure enough, they did that test, and that virus showed up as H5N1 in this human. And what was concerning is that this human ended up in the hospital setting. They actually did have a pretty severe infection. Thankfully, they recovered. But they did not report any animal exposure at all. So up to that point, all of the cases that were identified had a link or an animal exposure to livestock, but this was the first one that did not. In addition, since then, we now know that there was a suspicion that potentially even some healthcare workers, up to 6, were also exposed and infected. Thankfully, more recent follow-up testing has suggested that those healthcare workers were not likely infected with H5. However, that follow-up testing did show that another person who was living, cohabitating in a house with the first case also was likely infected with H5N1. So this raises the most important question that we look at in epidemiology: is there human-to-human transmission? And then ending up on the final 2 cases, in California, I mentioned we've had a high rise of cases there in the last 30 days. Interestingly, in those cases, we've also observed a higher mortality and rate of morbidity among those herds. In other states, typically, when the virus infects the herds, it will cause some mastitis, some fever, a drop in milk production, and those cattle will be sick for a little while, but they will recover. and they will, most of them can end up going back into the milk production cycle. However, in the case of a lot of the farms in California, they had much higher rates of death. So 15 to 20% of the herd that were infected were dying. So again, anytime we see a change in the behavior of the infection, that indicates, well, maybe the virus is changing. In the case here, we look at what we term virulence. Is the virus causing more severe infection? And if it is, that's something we need to pay close attention to. And then lastly, a very important event that just happened a week ago, the USDA announced that they had the first infection of H5N1 in US pigs. And this showed up in a farm with mixed animals in Oregon. So that had some pigs, some goats and sheep, and also some poultry. And so the poultry were infected and shown to be infected with H5N1. And then there were some pigs there, one of them showing a positive test for H5N1. We know that swine are a mixing vessel for flu because they can carry multiple strains of virus at the same time. If you remember, I mentioned 2009 influenza pandemic. That was ascribed to a pig reservoir. So if this starts to show up in pigs, and pigs become a more common reservoir for H5N1, that will definitely raise concerns about this potential for recombination. So thankfully, right now, that seems to have been an isolated incident. We have not seen this virus show up in other pig herds or other pig settings, but we have to be very vigilant and make sure that we're monitoring those for that purpose. So coming to the end here, what can we do about it? Well, what I would propose that's really critical, and what you've probably heard throughout the talk, hopefully, is that active surveillance and testing is key. As epidemiologists, we're only as good as the data that we can get about the circulation of a virus to understand how it's transmitting, what are the risk factors, what are some things that we can then identify and focus on for prevention. But if you are aware of the situation for H5N1 and bird flu and testing, it is very challenging. And it's challenging for very legitimate reasons. There is a very real economic concern for farmers with the detection of this virus and other things that when people do testing that can cause some economic issues. And so that's a very real concern. So there is some resistance to doing direct surveillance in farms because of that fact. There is not a mandate or requirement that farms necessarily do ongoing surveillance for also that reason. And so what are some ways that we can still do testing? I'll talk about that briefly. But also as this part for active surveillance and testing, responding to those results and communicating those with others. So building communication networks where you can share information with other people, whether that be farm to farm, whether that be if you're in a government agency, contacting and being in communication with the farms or other stakeholders that are in these settings is a really critical part of making sure that information is being shared and communicated appropriately. So one of the alternatives that we have been looking at that utilizes this One Health approach is using indirect sample testing, and milk and wastewater seem to be pretty good indirect ways to look at H5N1 in an environment. The USDA has been doing bulk milk testing. They have implemented previously in the year something called the Dairy Herd Status Program. And farms can volunteer to do this. And when they volunteer, they agree to have their bulk milk tested. And when they have negative results over a certain period of time, then they are no longer required to do the testing when they want to move dairy cows from state to state. So it's a way to monitor the health. And we have had a number of farms sign up for this herd status program, but not a lot. More recently, the USDA has announced additional actions where they say they're directly working with state agencies and the veterinarians in those states in order to develop more robust bulk milk testing programs. This was announced more recently, but we don't really have a lot of details yet on how that's being implemented in various states. Some states have announced those plans, other states have not. So we'll start to see, I think, more information about this as we move forward. But I think this is a positive step forward to see about maybe tracking H5N1 in a more robust way directly in the farms. The next thing that's been used is wastewater surveillance, and this is something that has come a lot out of the COVID-19 pandemic, recognizing that wastewater or water that's collected at wastewater treatment facilities is actually a really good way to monitor on a population level what is circulating in that population. So there's some really good publications on this. Again, I provide links for everything here, so this is a very good resource for all of you to look at later. You can go and access these. And in particular, we have two national wastewater surveillance programs. There's some overlap in these programs, but then there's also some separate facilities that each one covers independently. But you can go to these websites and you can navigate through and you can look at what the data is on wastewater in an area that you might be located in. I will also mention here, though, there are some limitations. Not everyone participating in this wastewater surveillance program or programs are doing H5 subtyping. So you have to be aware of if you're in a state that is doing subtyping versus not. There's some maybe potential limitations there, but there is a way in here for all of the systems to track influenza A, which is a really helpful way to monitor the rates of flu in an environment. Next, what we can do is vaccination. Now, we don't have an H5N1 specific vaccine that has been put out or recommended even for people. However, there is a great amount of work being done on developing an H5N1 vaccine for cattle and also potentially poultry. And so these are mRNA vaccines, which are similar to the vaccines produced through COVID. And there's a big push through the USDA and FDA in order to get these on the market so that they can be used directly in animals. Alternatively, though, seasonal influenza vaccination is also recommended for people who have exposure to livestock. And the reason is, again, mentioning the recombination ability. If you reduce the amount of human influenza in a person, that will then reduce the amount of potential transmission of that virus in a livestock herd, where you then are reducing the amount of recombination that could occur. So the CDC has recommended anyone with livestock exposure, they do get a seasonal influenza vaccination. And we have some programs, at least in our, even through our center in our institution, that are helping to provide those to individuals in our area. One of the greatest ways that farms and other people that are doing livestock production can protect their herds and themselves is through biosecurity. And most people who are doing commercial operations will have biosecurity in place, but we do know there's a lot more people doing backyard poultry and livestock production who may not have biosecurity controls into place. So there's a lot of effort now and a lot of resources that are available for providing that information to those individuals who might be working through those operations. We break biosecurity down in a number of ways, but one way that's often looked at is engineering controls. So the way that air circulation occurs, particularly in barns or places that animals are kept. Administrative controls, where you might have a plan, so a health monitoring plan for your animals or people if symptoms occur. Emergency preparedness plans, testing plans. And then the big one, personal protective equipment. Now, there's been some real big challenges here, particularly individuals working in farms where, the recommendation to wear a face mask or a face shield or protective clothes where there's extreme heat is a really difficult thing to do because you're increasing then the risk of heat-related illnesses. So there has been some recognition of that and some modifications of PPE recommendations. A lot of that is being updated through the CDC website, but there's also some other resources that I'm going to provide links to at the end of this presentation you can access as well. And one of those resources is the biosecurity frameworks. One of the largest ones being used in dairy farms is put out by the Farm Standards Program. And this is a link here to the website, and they have really good resources and an updated program that allows individuals to be able to implement a biosecurity plan within their operations. We also have similar resources through SMS, which is known as the Secure Milk Supply. And then every state is starting to, I think, to also develop their own resources. California has a really good repository of resources, so I listed that here, but there's some other states that have state agencies that are also providing biosecurity templates and checklists. And then coming to the end here, emergency preparedness and response. What does a farm or what do farms do if an outbreak were to occur? So it is really important to do scenario-based planning. So if you're working with farms and you can work through an idea of, hey, what would you do if an outbreak occurs? Having something written up is really critical because it helps ensure that those plans are going to be set and that training in those plans can occur, particularly when there's workers in those environments. We have been working with some of our agencies within Florida, including our what's known as Florida SART, or the State Agricultural Response Team. Those are existing frameworks, and I would encourage anyone to look into existing frameworks in your state, even your county. But if there's not a robust amount of emergency preparedness and response frameworks for ag issues, you may also look into a national network known as EDEN, which is the Extension Disaster Education Network. And this is a network that is run through all of the extension programs and often the land grant universities in each of the states that are developing additional resources for implementing emergency preparedness and response for H5N1. So at the very end here, rounding it out, we want you to also be recommending that you stay informed. Be very cautious about information shared through social media. Definitely only try to use verified resources and references. There's a list of the primary ones here, but also throughout this presentation deck, I have listed all of the links to everything that I've shared, and those can also serve as very good resources for you if you want to continue to track information on H5N1. And with that, I'll end and leave some time for question and answer. And I appreciate all of your attention for that presentation.
Great. Thank you so much, Dr. Anderson. We appreciate your time today. And so there are a couple of questions already here, and I can read that to you. If you do have a question, we are getting close to the top of the hour. So if we can't get to your specific question today, we'll try to answer that as quickly as possible. But we have a guest whose name is also Ben from Uganda. And I believe the context here is the African continent. He said apparently One Health approach is not taken off. Again, I'm assuming there he's talking about Africa. How best shall we make it work for the entire African continent? And he also has a request about potentially receiving your slides as well. So.
Yeah, so we'll definitely be able to make slides available to any of the participants. I'll refer to Ricky on that to see what the logistics on that would be.
Sure.
But for the question about Africa and One Health, One Health actually has been really strongly developed and implemented in Africa, but led by a few different countries that may have been taking a higher lead in it. I would encourage you to check out what's known as AfroHoon. So that's the Africa One Health University Network. And there's a very good website online for AfroHoon, and you can go on there and you can see which institutions and in which countries are taking a leadership role in One Health. And there's a lot of opportunities through those resources to engage in that process and also to participate.
Great, thank you. Another question here is, can serology be specific to this H5N1? Has serosurvey been done among dairy, poultry, and swine workers in those states?
All right, see that question. Thanks, Dr. Yang. So yes, there are assays that have been developed. There are a fewer number of commercial assays, but there have been laboratory assays that have been developed to look at antibodies. And for individuals who may not be aware or know about this, when you have an infection, your body will create an immune response. And one of the immune responses is you will have antibodies, those defense cells that are going to be clearing that virus out of your body. When that virus is gone, those antibodies stay. And so antibodies are a way for us to look at historical infection, particularly if those antibodies last for a long time. Now, thankfully for flu, they do last for a long time, but unfortunately for flu, there are a lot of different flu viruses that create antibodies that may be difficult to distinguish one from another. We are fortunate that in dairy cows, they don't have other influenza A viruses circulating. So it actually has been very helpful there to be able to use seroepidemiology or serosurveys in order to monitor that. That has not been done as much as I would say is needed. And that's typically because the laboratory capacity to do that is not often in the state or federal resources. It has to be done by the USDA, APHIS, or done through other partners like academic institutions like ourselves. And so I hope that we'll see more of that as we move forward into next year.
Great, thank you. The last question we have right now, again, if you do have a question, please type it into your Q&A because we will be running close to time. But we have someone who's anonymous that said, I've heard the bird flu vaccine didn't prevent catching the disease. What are your thoughts?
Yeah, I mean, this is a really great question, and this is a question that came up often through COVID as well. What is the impact or effectiveness of a vaccine? Our ideal when developing vaccines is that it would absolutely prevent all transmission. That is the ultimate vaccine. When we can do that, that is amazing. But it turns out for a lot of viral infections, particularly RNA viruses, that is not how the vaccine is going to work because the virus can evade again the antibodies that are produced by the vaccine. It can change, and those antibodies may not then work as well. But what we do know with influenza, while it may not completely eliminate transmission, we do know that's a really important effect on the reduction of severe infection and the duration. And this is also true for COVID. And so why COVID vaccinations are recommended is because it can reduce the severity of an infection and also how long a person may be symptomatic, which can also limit the amount of virus they may transmit to other people. So while it might not be an absolute perfect vaccine, it is a tool that can be used in a series of other tools that are really effective in mitigating and preventing transmission.
There's one more question that just came up. It says seasonal flu vaccine is based on last year's flu, to my knowledge. So how will that help?
Yeah, so this is really interesting. A lot of people don't always know how the flu vaccine is developed. So influenza has a robust global network of surveillance. They call it the Global Influenza Surveillance Network. And this is operated by a number of different partner countries and also the WHO, and it's been operating for a long time. And so through that network, it collects data constantly about what kind of influenza viruses are circulating throughout the world. Because of this change in the virus, we need to understand what the latest version of the virus is so that the vaccination could be best matched to that. So in the beginning of every year, usually in January, February, a group of experts will meet and they will come up with whatever that combination of strain vaccination mixture should be. And they do this based off of what they have seen circulating in the southern hemisphere because they have an inverse season than we do in the northern hemisphere. And so they take that data and then they use that to predict what the northern hemisphere is probably going to experience as their next epidemic seasonal wave comes through. And that's what they pick for the virus strains. They send that to the vaccine manufacturers. They update those strains and produce the new vaccines for the seasonal flu season. Is it always a good match? No, it's not always a good match. Some years we have better matches than others, and it all depends on how quickly the virus might change for that particular year.
Great. I think that's what we're going to have to call time on for right now. Thank you again, Dr. Anderson, for your topic today, using a One Health approach for H5N1 response in agriculture settings. In the chat, I've placed a couple of times a link to an assessment or evaluation. We really would like to get your thoughts or input about the webinar today to help us to plan for the future webinars. This will be the last agricultural health and safety webinar for this calendar year. We'll pick up again after the holidays, but please keep in mind that the website is here at sccahs.org, or you can email if you have a question, and we will, again, with Dr. Anderson's permission, provide the slides or any other information to those of you who participated today as well. You can also email us at sccagsafety@gmail.com as well. So with that, again, thank you very much for your participation today. Again, thank you, Dr. Anderson, for the content that you've provided as well. And we wish you all a very good day.